Uh,
Oh, dai, c'è un'istigazione,
Hi everyone. I'm audible, right, guys?
Yes, sir.
Yeah. So today also we can discuss queries. If you have any doubts, you can ask. Okay. Complete queries we can discuss. Shankar, you start now.
Okay. Yeah. Good evening, all.
Good evening, sir.
Good evening. Yeah. So, what that? So Shiva discussed about the queries, right, yesterday. So today we discussed about the types of queries and basically what is a query first. That is what we'll discuss, and we'll go on in depth of queries and all. Okay. Okay. What is a physician query? Generally, we can. What do you mean that physician query? It's a communication tool, right? So it's a communication tool between the any healthcare professional. Means it's a coder, maybe nurse or anyone, any healthcare related profession who is working in hospital or a specific hospital setting. From or maybe it's a coder or nurse, anyone, and he send a query to physician. It's a we can call it as a communication tool. It's a between a communication tool between coder to physician. So nothing, right? So we have, in our office, like we are working, so we have a communication tool, like it we have Teams or maybe other some internal communication tool we are using to communicate with each other, like we are communicating your team lead or maybe your colleagues, anyone. So that is a communication tool. Same way, your physician query is the communication tool to communicate the physician. Regarding what will communicate with the physician? Suppose, yeah. So some people are background of IPTRG, they would know about this query process maybe, and outpatient side also they will use some queries sometimes. Specifically some facility they will use queries also, but most of the outpatient coders doesn't know this what is the query process. But who are from the background of IPTRG, they will know that the query process. So it's a communication tool between the coder and physician. Okay. So we have 1 minute, guys. So physician queries, there is some certain guidelines is created by HIMA and is formulated by HIMA. We can call it is a how to formulate or how to create a query form to the physician. So AHIMA given some certain guidelines. It has given some certain points to how to create a complaint query. So complaint query. What is a complaint query? Anyone knows this? Complaint query or non-leading query. You can call it as same two names, non-leading query. Okay. Second, non-compliant query or leading query. Okay. Just what you understand by this words I write it here, like I given here the complaint. What is the complaint query or non-leading query or non-complaint query or leading query? So both are terminology similar, but nothing, somewhere there some people are using what is the complaint query and some people are using non-leading query. See, it's a complaint query. We have some certain guidelines. Complaint, what is the complaint query? How you why you call it as a complaint query? So there is it has some unique characteristics. Like complaint query has some characteristics. It should be a query. So we discussed that. So we are sending query to from coder to or maybe nurse or anyone. CDA coder. We can, anyone know CDA coder? We can call it a CDA coder.
Yes.
Yeah. What does that mean, CDA? CDA coders, medical coders. Okay.
CD coders directly communicate with the provider for querying and all.
Yeah, CDA coders is nothing but it's a direct hospital setting. They will work in the along with the physician, maybe the same hospital they will work. So it's a clinic. CDA means, what is the meaning of CDA? Clinical documentation, right? Clinical documentation improvement. CDA means clinical documentation improvement. What they will do, clinical documentation improvement, is basically the CDA coders will code the accounts. Let me wait. Yeah. CDA coders will code the accounts before discharge. So the patient CDA coder, when they will code before discharge, patient not discharged from the hospital, before discharge. Before discharge, CDA coder will code that queries will call what query? Concurrent queries. If any queries arise during before discharge, that we can call as a concurrent queries. Okay. Then medical coders means that we are coding like India, from we are onshoring onshore coders, and maybe in India we are coding medical coders. Some now we are seeing CDA coders also working from India. No, that is not like so directly working. CDA coders also working from India. So clinical CDA code is nothing but they will work in before discharge of the patient to the from the hospital. Before discharge, whatever the document is available in the patient account, they will review the documentation. If any missing, any conflict or maybe anything is missing in the documentation, their job to fulfill the documentation accurately, concise and clearly, and by sending the queries to physician, that we can call as a concurrent queries. Concurrent queries, what is the meaning of concurrent? What is the meaning of concurrent? Concurrent meaning, anyone knows about concurrent? Concurrently means
Multiples.
current. So patient not discharged, it's same time is
At the same time.
yeah, same time, concurrently, we can say concurrently. So the queries are sending patient in the hospital, patient still in the hospital, they're sending queries to the physician. That queries we can call as a concurrent queries. And comes to medical coders, that our part, like when patient, medical coders will code accounts after discharge. Correct. Patient discharged from the hospital, maybe medical coder by coding the time patient not in the hospital, he's already discharged, and we are sending retrospective queries. Okay, what are the queries we send from the coders, the medical coders, that we can call retrospective queries. Understand? What is the meaning of retrospective? Retrospective means already had done, it's a previously is done. Now we are sending for that clarification. So patient, the documentation is documented, he discharged from the hospital. Now that file came to, that account came to coder, and now he's identified some deficiency in the documentation, and that query sending to physician, that we can call a retrospective query. So after discharge, what are the queries we are sending? That is retrospective. And before discharge, in the hospital, patient still in the hospital, that queries we can call concurrent queries. That CDA coders will generally sending a concurrent queries. Okay, this one clear? Okay, there are two queries, concurrent.
Sir, can you explain once a retrospective query?
Retrospective is nothing but
Hello.
yeah, I'm audible.
Actually, I did not understand. I could not understand. I think maybe the network was gone.
Yeah, I will repeat you, no worries. Okay.
Okay.
Yeah, Somnath, just nothing. Concurrent is a vice versa. Like, see, if a concurrent means in the hospital, we are sending queries. Patient still not discharged. Patient in the hospital, still we are sending queries. So retrospective is nothing but patient got discharged, that account came to the coder to code for billing. So it's nothing but before discharge, after discharge. Retrospective means completely patient discharged and came to billing, then we are sending queries to physician, that will count retrospective. Are you clear?
Yes, sir. Yes, sir. I mean, when medical coders are doing coding, I mean, after discharge, then if the query is generated, then it is called retrospective query.
Yes, correct.
Or
Exactly.
if
Yes.
the CDI coders, when CDI coders send queries, these are concurrent queries.
Concurrent queries because the patient not discharged from the hospital.
Yes, yes, understood. Okay.
Yeah. Thank you. So this one clear. Then I will clear this from here. Then we'll go to. So this one clear, right? Concurrent. We know concurrent query. Okay. Now we are talking about compliant query and non-leading query. Okay. What is that compliant query? What is non-leading query? We can discuss. Both are same. Don't confuse compliant or non-leading. What is the meaning of leading, non-leading? Anyone understand what is the meaning of leading?
Leading means if we are asking the provider that this is the condition you have to give, we should not lead the provider. That
Yeah, it's a simple words like what is the leading means? Someone forcing to give that, right? Leading means I'm leading you. So that query should not go as a leading way. Like I'm not forcing to give that answer. I'm not giving you like not leading. So that is what I mentioned, that leading means nothing. I'm not taking a control of physician or what is the responsibility to I'm not take care of. I need to give him the complaint query. So what is that? Complaint query has some characteristics. Okay. First one, clear documentation. That means we are providing. First, I will explain that first 1 minute. Query. We can assume this is a query form. So starting from here. Okay. So if complaint query we are raising means there are the 3 parts we need to provide. Okay. There are the 3 points. First point, medical documentation. Okay. First point, medical documentation. Second point, clinical indicators. And third point, treatment. And finally, our question to provide. Okay. This is our, for example, this is the query form. We can assume it's a query form. And before that, we have like normal, how we have a patient demographics. What is the patient demographics? Means patient name, DOB, all should be, if you take it as a patient query form, it should be like this: patient name, or maybe DOB, and admit date, discharge date, admit, when is discharged. These are the normal demographics we can see in the patient account. So this is the normal query form. So this generally will give this, and along with that, so if we can call it as a complaint query means, when we can call it as a complaint query, there should be a medical documentation. See, if you are sending a query to physician, you should mention first point. You can identify